In the first video, I described what knee hyperextension is and what that looks like and how to measure it. In this video, I'm going to show you what you can do about it. In the first video, I mentioned that knee hyperextension is indicative of quadricep weakness. The quadricep is the anterior, the front muscle of the thigh. I'm going to show you an anatomical picture of that so that you know exactly where that muscle is. Does that mean that you should isolate the quadricep muscle in strengthening when you have knee hyperextension? No. Muscles don't act as soloists, they work as a symphony. Different muscle groups fire in order for us to do effective things like a good plie, a plie for pushing off into a pirouette, the landing from a jump. The quadricep muscle works in concert with the hamstrings, the muscles posterior. So you shouldn't ignore the other muscle groups of the leg. However, it's the quadricep muscle that really needs to be strengthened, because when your knee goes beyond 0 degrees, when it goes into those hyperflexible ranges of motion, that muscle, the quadricep in the front, does not have to turn on. The knee pushes back, and so there's no muscle activity going on. And if you've seen people stand with their knees hyperextended, they're just hanging on their ligaments. So that brings me to what are ligaments. Ligaments are very, very short. They attach bone to bone. In the knee joint, we have several that cross through the middle of the joint, the lateral sides. So we have ligaments that keep the knee stable so that it doesn't shear too much. It reduces the shear forces on the knee. A lot of shearing goes on in the knee. That causes meniscus damage or cartilage damage, which is really, really bad news for everyone, including dancers. What can we do if our ligaments are hyperflexible? We strengthen the muscles that cross the joint. So that's the other reason the other leg muscles that cross the knee joint, with knee hyperextension in particular, should not be ignored. But the exercises I'm going to show are really working the quadricep muscle within a limited range of motion. Next part, limiting the range of motion. In the first video, I showed my elbow because my elbow hyperextends. Okay, this is something I was born with, so that would be 0 degrees. That's hyperextension. Say I wanted to go to the gym and do some arm strengthening. If I held a 5-pound dumbbell and I did a bicep curl, and then on the way out, I went all the way to my full range of motion, you can see I'm pushing my elbow into a more than, that's 0 degrees. That's more than 0 degrees. That's putting pressure on the joint and the ligaments. If I hold a dumbbell in my hand, that's going to put even more pressure on the joint. If I do 3 sets of 10 that way, and especially a lot of people relax at the end of the range of motion in the gym, that's going to irritate the joint. As well as irritating the joint, it may push that elbow over time into further hyperextension. And then I have all kinds of other problems with the cartilage in the joint and the muscles being way overstretched. So whenever you do a workout, it's very important that you limit the range of motion and go through the arc of motion slow and controlled, not slamming back and forth as quickly as you can, but controlling both the bending and the straightening. If I were to do those bicep curls, for me, if I was coaching someone, I would have them do the curl into almost full flexion, and then extension, I would have them stop even before full range of motion. The reason why is that people that hyperextend their joints, it's hard for them to feel where that happens. This to me feels like 0 degrees. It just feels like my elbow's straight. This feels like my elbow's bent. So if I go ahead and stop the joint to where my elbow is actually a little bit bent, I'm going to be maintaining a safe range of motion for that joint. The other thing with exercising for the knee is it's a little bit better to do what we call closed chain exercises. That's where the foot is in contact with the pedal. It's easier to feel where the knee joint is in space when you do that. So I'm going to be showing some different exercises. Some are closed chain. There's a couple done on the floor or on a bed, which are not. Again, you have to really be careful with the ranges of motion. And I always encourage you, if you want to do a strengthening routine for some hypermobility, that you see a physical therapist first. Number one, to assess your range of motion to see how bad the hyperextension is, how far you're going, and then to go ahead and get you through a program that you can follow up with so that you are sure that you're limiting the ranges of motion. Not everyone that works at a gym is going to have the knowledge to really look at not just the joint position, but the body position. All of that is super important when you do a workout. So here are my top. Are there loads of exercises you could do for quadriceps strengthening? Yes, but these are my top picks. So have a look, and hopefully this will help you out if you're having problems with knee hyperextension. As a review, the quadriceps starts up at the anterior pelvis, goes over the front of the thigh, over the top of the kneecap, the patella, and inserts just below the kneecap onto the tibia. This is the muscle that we're focusing on for knee hyperextension. You have a wall at home, a smooth wall would be best, or a smooth door. I'm going to have her lean against it, and then walk your feet away a little bit farther away from the wall. Okay, so you're leaning with your derriere, I'll show this from the side as well, and your whole back and your head against the wall, and you can hang on to the wall as well. And then I'm going to have her slide her back down the wall while her knees go straight ahead, stop. So it's almost sitting but not quite, holding for a count of 5, that's about 4, 5, and come up. And we're going to do 5 of those with a 5 count hold. Go ahead and slide down, stop, stay 1, 2, 3, 4, 5, and up, and again. This also works the quadricep muscle and a little bit of the hamstring. 2, 3, 4, 5. So that's really good for your jumps. And again, and make sure that the feet are pointed straight ahead. 3, 4, 5, and up. And just do 1 more. 1, 2, so it's that 5 count hold once you're all the way down and come up. That will really get those muscles working. Go ahead and show what happens when your knees comes together. So that is in proper form. Go ahead and separate the knees. Yes. So you want to make sure that that hip, knee, foot alignment stays true for the entire exercise. Okay, so here's a side view of the same exercise. Go ahead and bend your knees, going straight ahead. And a 5-second hold. 1, 2, 3, 4, 5, and up. So no lower than that. Go ahead and go partially, stop. That's not going to be enough. Go ahead and go down and go further. That's too far. Come back up, because we don't want to strain the knee. Go ahead and slide down once again, stop. I'm looking that the lower leg is vertical and it doesn't go into any greater angle than that. And up you go. So 5-second hold 5 times. This is an example of a leg press. You could use either a Pilates, this is a Pilates home reformer, or gym equipment. That position for the feet is not good to do a leg press in. That'll put too much pressure over the top of the knee. On a reformer, you would put the ball of your feet in contact. On a leg press machine at the gym, you would put the legs in the position I just showed. So on the reformer, I would want to limit the range of motion to about 90 degrees of knee flexion. And as you go, keep your hips, knees, and feet in one line. They should be slightly separated. And do a nice smooth range of motion as you go. When you're pushing, push only to knee extension to 0 degrees, but not hyperextension. You can keep your knees a little bent, but not pushing all the way back. So avoid the hyperextended ranges of motion, and I'm showing the back. That's incorrect. My back is lifting up off the bed there. You want to keep your back in contact as you extend your knees. So you have to engage your core. I'm putting my arms up out of the way so you can see my legs clearly, and you can do extension with both and then lower with one. That's eccentric, lengthening control, which you need especially for jump landing. With each of these exercises, I would recommend about 3 sets of 10 with medium resistance, nothing heavy. You can also raise up to your toes to simulate a releve. You could do that bilateral or with single foot. Here is the next exercise that I really like for the quadricep muscle for hyperextended knees. It is called a short arc quad, short arc quadriceps. Why? Because you're doing a short arc of motion, very little, for terminal knee extension, the very last bits until the knee fully straightens. That is usually the weakest range of motion for people with knee hyperextension. So it's a very efficient exercise to use. It's to be done very, very slowly with a 5-count hold over multiple repetitions for the biggest bang for your buck. When you do this exercise, I've already said that hyperextended knees should not be worked out with any type of resistance or without resistance into the hyperextended ranges of motion. And so when doing this exercise, instead of going, this knee is just straight, there is not much, maybe there's 2 degrees of hyperextension in my right knee. Most people, I would have them go to where their knee is all the way straight and hold it. If you have knee hyperextension, you're going to lift the heel up just a little bit and keep the knee very, very slightly bent for that 5-second hold. So you're getting the biggest bang for your buck for that quadricep muscle. And it will be difficult if you do this correctly. The second thing with this exercise is you're going to be tempted to sit up and watch it. That puts the quadricep at an advantage in doing this exercise because remember, it starts way up here at the pelvis. So instead of sitting up, it's best to lie down. So I'm going to lie back to do this exercise. And here, instead of keeping the other knee straight, sometimes that can arch the lower back off the bed. I like to keep the opposite knee bent so that there's no pressure on the lower back. And then from there, instead of all dancers want to point their foot with every single little thing they do. The problem with that is that it puts some tension over the anterior portion of the lower leg up to the place where the quadricep muscle inserts. So I want to take any pain or discomfort out of the equation. So instead of pointing the foot, I want you to flex the foot up for this exercise. Actively dorsiflex the foot. So this is very simple but tedious. You're going to partially straighten the knee. Remember, if you have knee hyperextension, you don't want to go all the way straight. You're going to keep the knee slightly bent. The foot stays flexed, and you're holding this for a count of 5, and then slowly lower. The reason for the slow lowering is that the quadricep muscle on the top of the thigh shortens as the foot comes up. You hold it there, and so it has to sustain the muscle contraction. And then when you lower it slowly, the muscle works in the lengthening phase, which is called the eccentric phase. That is your plie from landing. Really, really important for dancers because a lot of knee injuries and ankle, foot injuries happen on the landing. So those slow returns are super important. So again, you partially raise up the heel, not all the way straight, just a little knee flexion there. Count to 5 and then slowly lower down. Be careful that as you're going up and down, there's nothing happening in your back. The back should be stable. So wherever it starts is where I keep my back as I do the exercise. Ideally, there should be 3 sets of 10 with a 5-second hold without any weight to start. The other thing about dancers is like, give me the heavy weight. I can handle the heavy weight, I'm a dancer. Start without the weight first. If you do this correctly, it'll take at least a week in order for you to get a little less sore from this exercise in order to progress. I would use nothing heavier than a 3-pound ankle weight. So resistance, if you can find an ankle weight, would be directly around the ankle. And if you use something like a 5-pound weight, when you lift that foot off the ground, that puts a lot of pressure on the knee, a lot of pressure on your knee. You already have a lot of pressure on that kneecap and patella tendon if you have knee hyperextension. We're not about causing any more drama or pain or inflammation. So resist the urge to put the heavy weights on there. If you do this with a 3-pound ankle weight, with a good 5-second hold and a slow lowering, lying flat, that will be more than enough to get you where you need to be in order to try maybe some plyometrics, some jumping exercise, and some other drills so that you get stronger so that you won't have as much range of motion in the hyperextended range, and you'll have less knee pain and problems. I need to mention a couple of things about doing these exercises. If you have hyperextended knees and it's excessive, that's more than 5 degrees of hyperextension, the exercises will help strengthen the muscles to help reduce the shearing in the joints, and that's whether it's the knee or other parts of the body that have hypermobility. However, the ligaments, once they're overstretched, don't go back. That's why it's important to keep up with the exercises over time and also modify your dance technique so you're not pushing your knees back into hyperextension excessively. It takes a lot of control and it takes a lot of effort to modify your movements so that you're not hurting your joints. And that goes for just everyday walking and when you're standing around, not to be sitting with your knees slammed back in the joint, to be actively using the quadriceps muscles. And so you might need to see a physical therapist to help you get on the right track so that you can work on that on your own. For dance teachers in particular and coaches, there was a recent medical convention that I went to where a doctor was talking about a young woman that was around 16 years old that came to see her with her parents, and she had excruciating joint pain all over her body and she could barely walk. This young woman, when she was 6 and 7 years old, was a child prodigy in dance, and she was used in dance competitions, and the coaches loved her because they called her a Gumby dancer. She was hyper flexible. She can get into all kinds of contortionist type poses that were really impressive. The judges for the competition really liked her, and she got a lot of awards for her dance team, and so she was featured in a lot of dance numbers. The teachers pushed her really hard beyond normal limits. The coaches pushed her really hard to use all that excessive joint motion. And in the end, they were doing excessive damage to her joints. What the coaches and the teachers did not know is this young woman had a specific medical condition that was congenital. She was born with it. The hyperflexibility diseases that people are born with usually aren't tested and don't show up until they get into like 6, 7, 8 years old. So if you have a young person, even 10, 11, 12 in a dance school, and they've got really high extension and they can do the splits past 180, usually dance teachers are very impressed by that, and some of them unfortunately push them even farther. That is not what you should do. That is kind of a warning sign that maybe something else is going on. And, send young people like that to get checked out by a medical doctor to be sure that they don't have something like this young woman did that was an actual medical condition that could have been treated. But even more caution should have been used with her if she wanted to pursue dance. People with medical type of conditions that have all over joint hyperflexibility can still dance, but they need to take extra precautions. And this poor young woman, when she was at the appointment and she was finally given a diagnosis for this condition that she had, started crying. And she said, finally, someone's listening to me. And when I heard this story, I was really distraught because I thought everyone, all the adults in the room failed her. Her teachers should have picked up on this. The coaches should have picked up on this. Apparently the parents didn't know any better. So for heaven's sakes, watch out for these individuals. And even if you don't have joint hyperflexibility, you should never, ever stretch for it. The teachers and coaches that have kids get into the splits with books underneath their feet, that is ridiculous. And that is setting up your joints to become damaged. So work with the limitations that your body has. You could always strive for more muscle flexibility. And already as dancers, we're asking a heck of a lot for our bodies, and they have to last a long time. So be careful about the ways that you stretch, and I hope these exercises help point you in the right direction.